I just want to tell basically, good evening, everyone. I'm Dr. Saibabu, working as a consultant anesthesiologist in Apollo Hospital, Visakhapatnam. The basic idea of discussing this topic is I just want to give you a brief introduction of types of anesthesia. Types of anesthesia, what exactly role of anesthesiologist, what exactly each type of anesthesia, how it is performed, just giving a brief generalized overall view so that the target audience will get a picture of what exactly anesthesiologists do, what is the role of an anesthesiologist, how the types of anesthesia is, the different types of anesthesia performed and given. So this first slide, you can see how the surgery was conducted before anesthesia was invented. So patient was tied, patient, 3-4 people were holding the patient, and somebody shutting the mouth of the patient, and then patient was, the surgery was performed. Can go to the next slide. This is how patients were treated, prepared for surgery before anesthesia. It's all like a barbaric thing. So surgery was a terrifying, go to the next slide. Yeah. Next slide, please. Yeah. Surgery was a terrifying last resort in a final attempt to save the life. Few operations were possible. The surgical things that was considered was surface surgery, amputation, fungating cancers, and cutting of stone were the real only areas in which the surgeon could practice. That means prior to anesthesia era, the surgical practice was almost very limited. The surgeons used to have very limited opportunities to operate in certain fields. The inside of the abdomen, chest, and skull were essentially no-go areas prior to anesthesia. Speed was the only determinant of a successful surgeon. How a successful surgeon is considered is prior to anesthesia, how fast you are going to quickly complete your surgical procedure. He is the good surgeon. He used to be considered as good surgeon. Can I get this screen out of that way? Yeah. Okay. Am I visible now?
Yes, sir, you are visible.
Yeah. Okay. And most patients were held or strapped down. Some would mercifully faint from the agony. Many died either on the table or immediately post-surgery. This was the surgical conditions prior to the anesthesia era. Next slide. So when it is in the Hippocratic corpus that the word anesthesia was used for the first time in medical context as a reversible loss of sensation and unconsciousness, when Hippocrates himself has written, like from when they pass through the flesh and puff it up, the parts of the body affected lose the power of feeling. It is called anesthesia. Next slide. So Oliver Wendell Holmes, he is the person first who coined the term anesthesia in the year 1846. Anesthesia, the word originates from the Greek language. An means without and aesthesis means inhibition of sensation. Next slide. So what exactly is the definition of anesthesia is? Anesthesia is a partial or complete. Every word in this definition is important and specific. Anesthesia is a partial or complete loss of sensation with or without loss of consciousness that occurs on a temporary or permanent basis as a result of disease or injury or due to administration of anesthetic agent, usually by an inhalation agent or by an injection. So the word, the temporary or permanent, sometimes if you're not careful, the anesthesia become permanent and there is a loss of life also can happen. So each and every word in that definition is important. Coming to what is anesthesia basically is loss of sensation in all or part of the body with or without loss of consciousness. So anesthesia, its components includes analgesia. That means the patient should not have any pain while getting operated. Amnesia, the patient should not remember anything what is happening to him during the surgery. Paralysis, we need a calm, still, unmovable patient for the surgery to be performed perfectly. Unconsciousness, the patient should not be conscious. He should not be knowing anything. Anxiolysis, the patient was, prior to the surgery, the patient was very anxious. So that anxiolysis part. And sedation, the patient should have completely sedated. So all these things include component of anesthesia. So analgesia, amnesia, paralysis, unconsciousness, anxiolysis, sedation, all these are required for a perfect anesthesia. Next. So what is an anesthetic? Difference between anesthesia and anesthetic. Anesthetic is a drug that was given significantly, that when given significantly decreases the human response to pain or stimuli. So how we can give anesthetic? What are the various anesthetic drugs? There are the analgesics, which use like opioids and non-opioids. Paralytic agents like neuromuscular blocking agents, which we use during general anesthesia. Anxiolytics like benzodiazepines like midazolam, and sedatives like again opioids and again anesthetic drugs. Next slide. So now coming to anesthesia and anesthetics, we'll go overview. Who, why, how, where. So anyone who's screened by a preoperative evaluation. So a surgeon decides the surgery. After deciding the surgery, he'll send the patient to the anesthesiologist. The anesthesiologist will perform a formal pre-anesthetic checkup. So he considers that he decides whether the patient is fit for the selected anesthetic procedure or not. Based on that, if he requires, if the patient needs any further evaluation, if the anesthesiologist feels any further evaluation, he'll ask for a cardiologist or neurologist or nephrologist consultation based on the requirement of the patient. So anyone who's screened by a preoperative evaluation and deemed suitable to receive anesthesia. Why? Anesthesia is necessary for any medical procedure or test that requires minimal patient movement or pain feedback. And remember, anesthesia is given not only for surgeries. It is sometimes needed for a patient who is undergoing MRI, because most of the patients are claustrophobic. So to relieve the claustrophobia, sometimes we may have to give general anesthesia to a patient who is undergoing MRI, who is undergoing endoscopies, colonoscopies. These are called non-operating room anesthesias. Sometimes we have to give anesthesia in the emergency room itself, in a polytrauma patient who is in shock. So how anesthetics can be administered? Via inhalational route, through breathing, by intravenous injections, local injections, and regional blocks. Where settings in which anesthesia may occur is inpatient, operating room, emergency room, etc., outpatient office and surgical centers. When anesthesia can be performed as needed in a controlled monitored setting at a healthcare facility. Next slide, please. So there are four main types of anesthesia: general anesthesia, regional anesthesia, local anesthesia, and sedation. General anesthesia is the it is actually considered as a true anesthesia, where there is a reversible state of unconsciousness with loss of sensation to the entire body. In the general anesthesia, the patient was totally knocked off. He was put to sleep and again he was awakened. The entire thing was under the control of anesthesiologist. Sedation, decreased level of consciousness or relaxed state, but not fully unconscious. That means, what is the difference between general anesthesia and sedation is, sedation will not ask the patient, when we ask the patient to open his eyes, during sedation, the patient can open. But during general anesthesia, he was totally knocked off. Regional means the patient is fully conscious. He is only one part of the body, certain part of the body is blocked. Local anesthesia is just infiltration. Giving infiltration into the subcutaneous infiltration will cause anesthesia for the skin. So next slide. We'll be just seeing the individual anesthesia types of anesthesia, how they are performed. So again, anesthesia is local, regional, and general anesthesia. Again, in the local anesthesia, again two types: topical and infiltration. Topical is just application of the ointment. Infiltration is what I mentioned earlier, like giving subcutaneous injections. When it comes to regional anesthesia, it could be a peripheral nerve block, ganglion or plexus block, epidural. It can be epidural, it can be spinal, and it can be intravenous regional anesthesia. Epidural and spinal combinedly, they are called neuraxial blockade. Coming to general anesthesia, it will be total inhalation anesthesia, or it can be balanced anesthesia, or it can be total intravenous anesthesia, which is called analgo sedation. Next slide. So the reversible state of unconsciousness with loss of sensation to entire body. The classical put to sleep for surgery is called general anesthesia. This general anesthesia is achieved using general anesthetics, which include analgesics. I already told, like opioids like morphine and fentanyl, and Butram. And next, paralytic agents, neuromuscular blocking agents like atracurium, vecuronium, suxamethonium. Coming to anxiolytics like midazolam and lorazepam, which are the benzodiazepine groups. Next slide. So general anesthesia was not known until mid 1800s. Diethyl ether was the first general anesthetic used for the surgery. General anesthetics are divided into again two classes: inhaled anesthetics and intravenous anesthetics or induction agents. I just mentioned the names of the thing. I'm not going into the details of pharmacodynamics and pharmacokinetics and pharmacodynamics of each individual drug, because that itself will take another session. Next slide. So in 1846, William T.G. Morton became the first in the world to publicly and successfully demonstrate the use of the anesthesia for surgery. This occurred at what came to be called the ether dome. So basically, Gilbert Abbott is a patient who is having a neck tumor, and William T.G. Morton gave diethyl ether to the patient, and a neck tumor from the patient name is Gilbert Abbott, and neck tumor was successfully removed by Collins, the operating surgeon. Next slide. This is the ether dome where the first anesthesia was successfully performed.